This is Hormonify University coming to you from Deerfield Beach, Florida. And today our topic will be dealing with the ins and outs, drilling down into men and testosterone replacement therapy, and how does it make a man make a decision to take on the responsibility of testosterone replacement. First, let's talk about the differences between hormone replacement therapy in men and hormone replacement therapy in women. In my extensive experience, women do want to have more testosterone in their body for many reasons. The main reason is for sexual function. I know it's a topic that we don't talk about much, but believe it or not, you guys out there, women do respond with more sexual desire with testosterone levels being replaced, and they do desire to have more sexual intercourse when their hormones are back to where it needs to be. I have hundreds of patients who we take care of the female. Woman is back to normal, feels great, normal sexual desire, and the man is sitting there going, now what about me? Because they feel inadequate. And one thing about men is that they won't discuss their feelings about it. They're just going to avoid it, deny it, go on fishing trips, do their best to not admit that there's something wrong with their sexual function because they are testosterone deficient. Almost all the time in couples, it's the woman who suggests and encourages the man to come to me and get replaced, which is how I got involved with male replacement therapy about 10 years ago. So replacing testosterone in men is much different than replacing sex hormones in women. It's a lot simpler. Once you discuss with the men what they want, it almost always is never mentioning sexual function. It's usually the fourth or fifth item that's mentioned. And I think that's two reasons. One is that most of the time, men doesn't want to admit that they have a sexual dysfunction, even to another man. It's one of those machismo things that men are comparing each other to their sexual performance. And it's kind of an adolescent thing, but I find it very common among men who just don't want to talk about it. Therefore, they don't list it as, well, I want to have more sexual function. I want to have better erections. They talk about things like energy, loss of muscle mass. They feel comfortable with that. Sleep disorders, arthritic or arthralgias, which means painful joints. They are comfortable with that. As soon as it gets to the sex, they don't often admit that they have a sexual issue, even though I know they do because their wives or girlfriends are my patients who tell me that they need help in that arena. The second issue is that there's a lot of misconception about testosterone. That is that you have to take a lot of testosterone to get the effects you need, and that is absolutely not true. A lot of testosterone may actually make you aggressive, may actually make your endogenous testosterone go down, which means the ones that you produce by yourself. And even though it may build your muscle mass up, it also may create a problem in being very aggressive, and in relationships that's not good. So it brings to mind a study that was done, and it's been repeated many times, is that of the 24 hours in a day, what % of the time do men think about sex or sexual issues? And the study came up with really hasn't changed over time, which means a 25-year-old, a 40-year-old, a 60-year-old, it's about 4 hours a day. Interestingly, when the studies are done for women, it's probably about 1 hour a day, where a woman thinks about either something about masculinity, something about femininity, something sexual, not necessarily sexual intercourse, but definitely if she's honest with herself, it's probably about an hour a day. So men think about it, or at least comes to mind, about 4 times more frequent. If you ask the same question, by the way, about emotional issues, feelings, it's a reverse. Women think about emotional issues and feelings 4 times more than men do. And some women think more than 4 times. Some men think less than 1/4. Some men have no feelings at all during the day. The thoughts are not about feelings and emotion until they go home and they deal with their wife who asks them how they feel about things. So in my experience, That comes into play when it has to do with history and what men expect out of testosterone therapy. I have had patients who say, the reason why I'm here is because I want to have a better sex life. Yes, it definitely occurs, but almost always it's something not as straightforward, usually with the older men who really are beyond that machismo period. So when I approach the problem, I always do a complete medical history because unfortunately so many medications reduce blood flow to the genital area, and high blood pressure medicines, for example, a lot of cardiac medications, a lot of beta blockers produce the problem, and unfortunately they're on the medication. So my first line is usually to say, why are you on this medication, and is there a way of getting off? There's a lot of great products out there that are naturally based, that take care of blood pressure, take care of some cardiac issues. Some of them need to be on the medication, but many people can reduce their dosaging. Weight management is very important. Adequate fluids, drinking the water you have to take in every day on a daily basis will help lower blood pressure. Consuming minerals and mineral-containing foods. All of these things should be attached to the conversation as how do you get increased blood flow as we age to the genital area. So that does take a comprehensive approach, and I do believe that so many people are over-medicated. And men, yes, they need to be on a blood pressure medicine, but if they notice that their sex drive and their erections is reducing radically, they need to go back to the doctor and say, what else can I take besides this? There's so many natural products out there that they can take that can be adjunctive therapy, and eventually with weight management, reduction of obesity, we can reduce the incidence of erectile dysfunction as it relates to medication. There's of course a percentage of men who do have psychological issues, and of course we try to refer them to adequate psychotherapists who can deal with that issue, especially as it relates to post-traumatic stress disorder. So when I deal with a male, we do a complete history, we do get blood work. It's very important to ascertain what their estrogen and testosterone levels are. In most men that we see, the estrogen levels are elevated. Elevated estrogen levels, which is a feminizing effect, is not a very good thing for men. And as soon as I point it out to them, the first thing most of them say is, how come it wasn't checked before? And I say, I don't know. Doctors should know that men convert testosterone to estrogen their whole life. So it is also involved in our food supply. There's many foods that contain estrogens that we need to look at and reduce that, because the estrogen does have a negative effect. It makes the prostate grow. In the Wolffian Mullerian duct differentiation, embryologically, the Wolffian duct, which becomes the male, does get stimulated by estrogen just as much as the Mullerian duct gets stimulated. So a prostate, which is the analog in a male, correlates with the uterus in a female. So the same estrogen receptor sites are on those cells that get stimulated by excessive estrogen. So just as important as treating testosterone is to reduce the estrogen level with anti-estrogens. We have different modes of therapy for that. Some natural products do have a positive effect. Even though there's some controversy, Soap Palmetto Plus does seem to have a positive effect, as well as DIM, which is a natural product. We do use anti-estrogen prescriptions for those that need it to help us balance out the two hormones. Just as important is weight management. Males also have body image problems. So if a male is obese, or if a male is having a big stomach, it does perform and cannot perform as well as he would. Normally, we try to gently move him in the direction of recognizing that weight management is very important in sexual function. And I think it is very helpful that the conversation does occur. And unfortunately, most doctors do not take the time to deal with incipient obesity as it relates to, in itself, sexual function. And also it should relate to the issues of high blood pressure and cholesterol abnormalities. So I think that's a very important conversation to have, and it should be had every visit when a male is taking any of those medications to help them in that regard. Another aspect I think is very important is for a conversation to occur between the couples as to what their sexual frequency preferences are. Women, I find in my practice, a little hesitant to do that because they don't want to make sexual demands on their partner but the conversation should occur at least so that the frequency is a kind of an agreement between the two partners so that both people are happy and are able to satisfy each other, which is an obligation, of course, that we should look at seriously. Unfortunately, today, we have issues in relationships whereby we don't discuss the real issues. And the real issues should be discussed not only with each other, but also with their doctor. So I find a lot of people who come to me have never discussed the testosterone issue with their primary doctor. Never. It's never brought up. It's never discussed. And in fact, the doctors may say to the patient, well, you don't need it. So the guy will usually say, hey, check my levels anyway. Levels come back extremely low. And then they say, well, you really don't need it. I get it because I checked it because you wanted me to. And so the guy is saying, yeah, but it's low. Shouldn't it be at a higher level? So I think that issue of education to physicians occur. And like I say, a lot of times we spend a lot of time educating other providers. And so that helps a lot in terms of getting people to realize that in men, testosterone levels are very important. Muscle mass goes down if your testosterone goes down. Muscle mass is very important for overall health, also for weight management, and also just for strength. Men like to feel strong. They like to have upper body muscles, and if you, over a period of time, are testosterone deficient, your muscle mass will deteriorate over time, and that is something that makes men, in their body image, less appealable. As it relates to that, it's a very interesting corollary I'm going to mention here, in that in my extensive experience, women who are placed on hormone replacement therapy adequately by Hormonify have more intercourse. Also, interestingly enough, those women without partners, within a short period of time, even though they deny their need to have partners and they don't really want to have partners, will develop a relationship almost within 3 to 6 months. And I don't think it's because we're replacing the women's hormones that make that happen by itself. Men are trained and men have an ability to discern women that are releasing pheromones and releasing the byproducts through the air of hormone replacement therapy. So not only are the women having more desire, men know in some level that these women are hormonally adequate. This is not much different from many other mammals, but we don't recognize that consciously. A good study that was done, was controlled, was a study done for young people between 25 and 40 that were met in a room, and the women gave histories of whether or not they were on birth control pills and where they were in their cycle. And then men rated the women in the room, they had numbers on their lapels, as to who they wanted to have sexual intercourse with, even though they did not know them. They had a chance to talk with them. They discussed whatever politics or whatever issues they want, and they rated the women, and they gave them the priority of top three women that they picked was more consistent with not the beauty aspect of the woman or the intelligence, was whether or not they were on birth control pills, which scored the lowest, whether they were ovulating, which caused the highest, or whether or not they were actually on adequate hormone replacement therapy. Those factors were much higher than the physical look of the woman. The highest was a woman who was around her ovulatory cycle. So instinctively, men who were bred for who knows how long, probably created to propagate the race, to present themselves to the woman who is most likely to get pregnant. I know that's a very anthropologically, politically incorrect statement, but it makes perfect sense to me, and in my experience, falls into that line. So not only women, when they get fixed, so to speak, with their hormone levels, want to have more sexual intercourse, men pick up on that. And that interesting sort of tidbit should motivate men to have their spouses corrected as far as their sex hormones, and then they should also be corrected, because testosterone definitely makes your upper body and most of your muscle mass increase, which is in itself sexually attractive to almost all men, all women. And I think that key issue also helps in the sexual frequency, not just the absolute value of testosterone causing better erections, but also making the women more available to their spouses when they look more masculine. And I think that issue is not discussed much, but it really is an important aspect to what we do, is to work with couples and make them feel more comfortable with being in better shape. Exercise is obviously important, but also is hormone replacement therapy. In my experience, which is quite extensive, women especially, no matter how much they work out, if they do not have testosterone, they don't build their body as much as they should. They have less muscle mass than they would like, and men especially so. So I hope this was helpful. This is Hormonify University, hopefully educating the populace and also other physicians and nurse practitioners who are listening to this. Give us a call if you have any questions. Thank you very much and have a great new year.